Good Shepherd Healthcare System is a nonprofit, 25-bed critical access hospital in Hermiston, Oregon, serving the greater parts of Umatilla and Morrow counties. Over 750 employees are part of the Good Shepherd family, whose dedication to serving our patients comes first and always. Good Shepherd's mission is to improve the health of our community we all know and love. More than 30 trusted physicians and clinicians work tirelessly to give you their very best, striving to ensure our patients feel just a little bit better going out the door than when they came in. Good Shepherd has the latest, most cutting-edge technology, including the Da Vinci robot, the Mako robot, top-of-the-line MRI for diagnostics, and more. Our employees strive to meet the most current education requirements and quality measures to deliver the best healthcare possible in rural Eastern Oregon. With over 40 service lines, Good Shepherd is here when you need us. Being able to touch our little corner of the world and leave it better than we found it is the greatest privilege anyone can ever have. Thank you for trusting us with your care. Good Shepherd Healthcare System. Patients first. Always.
Good evening to everyone. Welcome to Good Shepherd Healthcare System's 5th Annual Community Meeting. My name is Sue Daggett, and I'm Chairman of the Board of Trustees of Good Shepherd. Our annual community meeting is intended to be open to everyone in our service area. The operation of Good Shepherd Healthcare System revolves around our patients and their families and friends. Everything we do is targeted at improving the health of our communities, and we need to know what you think about our plans for new services, providers, and facilities. This marks our 3rd year of presenting our annual community meeting virtually. As with so much else, we're asking, is this our new normal? Virtual meetings and gatherings have opened up many opportunities to connect and share information with others far away, but it just can't replace the energy and engagement we create when we're together. Whatever our new normal may be, I believe it's filled with great potential here at Good Shepherd, as we have exciting projects happening in the near future. During my tenure as a Board of Trustees member, I've often reflected on how much and how fast healthcare has changed over the years. Being told by a physician you need an operation used to mean a lot of pain and a long recovery. The Da Vinci surgical system at Good Shepherd allows certain procedures to be done with minimally invasive incisions. The risk of infection and the amount of blood loss are greatly reduced, and it allows our patients to resume their normal activities sooner. X-rays were discovered in the 1890s. Before then, a problem within the body was found and diagnosed by cutting the patient open. MRI and CT scanners now detect issues that can cause future problems well before we're aware of them ourselves. The example that hits closest to home for me are the advances made in orthopedics. During the Great Depression, my grandfather was seriously injured in a mining accident in Baker County. He suffered numerous broken bones. In a remote rural area, the only treatment available at the time was bed rest, with the bones healing however they could. He never walked properly again. My grandfather's experience would be so different today. Our new Mako surgical robot has unprecedented ability to measure and shape tiny areas of bones for a joint replacement procedure, allowing our patients to return to an active life. These are all wonderful new technologies, and we're going to improve patient outcomes with them. As with any new normal, we also have plenty of challenges ahead, both here at Good Shepherd and in common with other hospitals at the state and national level. Provider shortages are on everyone's mind. The stresses of the pandemic caused many healthcare professionals to leave the field, and tragically, others lost their lives trying to save others. How do we inspire the next generations to consider a healthcare career? Good Shepherd is exploring how we can identify students and other community members with an interest in the field, and equally important, make sure we have the educational resources to help them achieve their career goals. Building our physician and nursing resources is a long-term challenge. In order to use their time more efficiently in the present, we all need to become better patients. A wealth of information about diseases, conditions, and treatments is available, and educating ourselves about them adds value to the patient-provider relationship. And yes, we all need to make healthier choices about diet and exercise in our lives. One of the new acronyms in healthcare is DEI, Diversity, Equity, and Inclusion. Traditional healthcare works well for many, but misses the mark for others. This is a common theme at healthcare gatherings around the country. We are encouraged to find innovative methods to care for those who speak a different language and come from a different culture. We need to remove barriers for low-income families to access services. We must provide better coordination of care for our valued elders living in care facilities. Mental health is probably the healthcare topic at or near the top of everyone's list. We will hear from Karen Wheeler from Greater Oregon Behavioral Health in a few minutes about this issue in our area. Funding for facilities, staffing, and treatment is a concern in every community and every state. In addition, we must recognize and respond to the needs of families and friends, providing vital caregiving to mental health care patients. I appreciate my colleagues on the Board of Trustees and their ability to look into the future and imagine where healthcare is going. When discussing a project, someone usually asks, will this meet our needs in 5 years, 10 years? Is this a good investment now, or will something better be available soon? Is this need even going to exist in the future? The old normal, when hospitals had a pretty good idea of what would be needed in the near future, is long gone. 12 residents of our service area serve on the Board of Trustees. I have the pleasure of working with Board Vice Chair John Lawrence, Secretary Bill Elfring, Treasurer Tom Walmsley, and Trustees Bob Carlson, Steve Eldridge, Rachel Archer, Arnell Enan, Nancy Mabry, Dr. Derek Earle, Lisa Middlesdorf, and Jeff Winholz. Good Shepherd Healthcare System is blessed with a rich history and valued traditions. Our old normal has served the community well for almost 7 decades as we cared for generations of patients. We'll carry that heritage with us into the exciting and bright future of our new normal. I have the pleasure of introducing tonight's guest speaker, Karen Wheeler, who will present an overview of behavioral health in Eastern Oregon and at the state level. Ms. Wheeler has served as CEO for Greater Oregon Behavioral Health, also known as GOBE, since 2020. Welcome, Karen.
Hello, I'm Karen Wheeler, CEO of Greater Oregon Behavioral Health Incorporated, also known as GOBE. I also have the pleasure of serving as the Tribal Liaison and Board Member for Eastern Oregon Coordinated Care Organization, or EOCCO. It is an honor to speak with you about the status of behavioral health in Oregon, as well as policies and funding initiatives that are shaping our future. I understand key informants have prioritized mental health during the Good Shepherd Health System Community Health Needs Assessment and the Community Health Improvement Plan processes, and that GOBE is identified as a key partner in the CHIP. GOBE is a frontier, rural behavioral health and social services network empowering individuals and communities to achieve better health. We envision strong, healthy communities where all individuals are supported in achieving health, wellness, and their full potential. Founded in 1994 by Community Mental Health Programs in Eastern Oregon, GOBE is a 501c3 nonprofit corporation charged with administering the behavioral health Medicaid benefit, non-emergent medical transportation, and community engagement throughout 12 rural and frontier Eastern Oregon counties and true tribal nations in the service area. We are a co-owner of EOCCO, along with Moda Health, Good Shepherd Healthcare System, St. Anthony Hospital, and other health systems in the region. GOBE manages the behavioral health care for 70,000 EOCCO members across the region. The bars on this diagram represent the volume of members by zip code throughout the service area. The average age of our members is 27. 53% are female, 8% have a disability, 34% are Black, Indigenous, and people of color. Many factors influence mental and physical health. All of us have biological and psychological characteristics that make us vulnerable or resilient in the face of potential behavioral health conditions. Risk and protective factors exist in multiple contexts such as families, communities, schools, workplaces, peer groups, and individual factors such as genetic predisposition, positive self-image, self-control, and competence. I put this image together to illustrate how individual, family, community, state, and national and worldwide factors affect our health and behavioral health. As you can imagine, we are all connected. Conditions and events across the globe affect us all. Within the family and relationship context, we are deeply connected and contagious to one another. Early life experiences actually get under the skin and into the body with lifelong impact to adult physical and behavioral health. Children are born learning. Nurturing environments and quality early learning help set up the foundation for life success. Speaking on this connection across continents, most recently, behavioral health and mental wellness has become a hot topic due to the impact of the worldwide pandemic. The pandemic has put an exclamation mark on the need for behavioral health services and has exposed weaknesses in the system and the overall healthcare system. Isolation and loneliness, grief, anxiety, depression, alcohol and substance misuse, and stress-related symptoms are all on the rise, as we have experienced disruptions in work and school routines, lost businesses, lost loved ones, and lived with uncertainty about the trajectory of the coronavirus. I would also note that the healthcare system professionals who have been working on the front lines during the pandemic have experienced and continue to experience burnout and compassion fatigue as we've never seen before. The pandemic has opened up our public discourse around mental health and well-being. Of note is the well-being and intellectual development of our children. Children have been significantly impacted by this pandemic. As reported by Oregon Public Broadcasting on September 22nd, test scores fell by 9 percentage points at the state level, and even more sharply at some of the large school districts. Colt Gill, the director of the Department of Education, stated, "School was disrupted, school was delivered differently, families were under stress and trauma, as were educators." The Centers for Disease Control and Prevention data show that the proportion of mental health emergency visits for children started going up early in the pandemic. In the fall of 2020, the American Academy of Pediatrics, the Children's Hospital Association, and the American Academy of Child and Adolescent Psychiatry declared an emergency in child and adolescent mental health. The United States Surgeon General also highlighted this crisis in an advisory on youth mental illness issued in December 2020. The COVID-19 pandemic has increased demand for behavioral health services, with over 500,000 new people reporting signs of anxiety or depression between January and September of 2020. Alarmingly, we are seeing a perfect storm of increased need and demand for services and difficulty accessing care. That said, an encouraging development occurred in the use of telebehavioral health. The utilization of telebehavioral health services increased significantly, with virtual therapy and psychiatry usage growing by 302% compared to pre-COVID-19 utilization. This trend was also borne out in the Eastern Oregon region. Overall, behavioral health services provided via telehealth were amplified due to the COVID-19 pandemic, with 42,493 services provided in 2020 compared to 3,761 in 2019. I'd like to talk a little bit more about the challenges that I see facing the behavioral health system. The first challenge I'll speak to is workforce. We are experiencing a workforce crisis. There are simply not enough people entering the behavioral health workforce pipeline. There are over 120 vacancies across the Eastern Oregon community mental health system. Further, significant gaps exist in the number of Black, Indigenous, and people of color, especially Hispanic Latinx populations entering this workforce. Second, there have been inadequate investments in capacity. Decades of underfunding in the behavioral health system have resulted in inadequate capacity to serve Oregonians with behavioral health needs, including prevention needs across the lifespan, but especially for children. Services for people who speak a language other than English are woefully inadequate. The Oregon Health and Science University, Portland State University School of Public Health conducted a recent substance use disorder gap analysis. Its findings were grim. As reported in the Lund Report on September 30th, the researchers found substantial shortages in programming, facilities, and labor exist across every county and region of the state. Every county is at a moderate to high risk for having substance-related hospitalization rates above the national median, according to the report. Overall, the report suggests Oregon's system for meeting the needs of people with addiction is about half the size it needs to be. The report estimates 12,109 individuals in Umatilla County needed but did not receive treatment in a specialty facility for substance use disorders in the past year. Policy and regulatory misalignment is another challenge. The policies governing Oregon's behavioral health system are outdated and disorganized. The statutes were drafted for the most part in the 1970s and 80s and do not clearly articulate modern roles for the state, counties, community mental health programs, CCOs, and private providers. I am encouraged by recent discussions with legislative leadership about the focus in this area for the 2023 session. And finally, stigma. Unfortunately, there is still stigma associated with having a behavioral health condition and seeking help. This influences individual decisions regarding seeking care, including delaying treatment until conditions are chronic, impacting life functioning on many levels, and at times resulting in horrible outcomes, such as suicide or overdose. Despite these challenges, there are things that bring me hope about the future of behavioral health in Oregon. As of July 1st, 2022, people who live in Oregon who meet income criteria, who did not previously qualify for the Oregon Health Plan benefits because of their immigration status, and are between the ages of 19 and 25, or above 55, are eligible for full benefits. We will see how the end of the public health emergency and subsequent redetermination for Oregon Health Plan membership affects Medicaid enrollment in 2023. That said, the Oregon Health Authority is rolling out a basic health plan for those making more than 138% of the federal poverty level in order to minimize loss of coverage for people no longer eligible for OHP. As announced September 28th, the federal government has approved Oregon's new 5-year Medicaid 1115 demonstration waiver. $1.1 billion of new funding will support additional flexibility in spending of state and federal Medicaid dollars on health-related social needs such as food, housing, and climate-related programs and services for people and families experiencing critical life transitions. While there are ongoing negotiations on several of the provisions OHA proposed in the waiver, the approval of these elements is welcome and will help Oregon to continue to move upstream in an effort to prevent chronic illnesses and poor health outcomes. The changes include continuous coverage for children under the age of 6 and 2-year enrollment periods for people over the age of 6. This will lessen the loss of coverage associated with the administrative hoops of yearly eligibility checks. This provides opportunities to engage children and families in early childhood services, including behavioral health services. The early years matter. In the first few years of life, more than 1 million neural connections are formed every second. The diagram here is from the Heckman equation and demonstrates the rates of return to human capital investment by age. Investing early pays off significantly with factors associated with productivity, employment, incarceration, crime, and incidence of disease. Under the new waiver, Oregon will make investments in services that people need during life transitions to address their health-related social needs, such as medically tailored meals and housing supports. We know people with behavioral health needs have significant health-related social needs. At GOBI and EOCCO, we have been investing in social determinants of health since the beginning with programs like Frontier VeggieRx, Cribs for Kids, housing development and rental assistance, and flexible funding through health-related services and other state non-Medicaid programs. We've also invested in the Unitas platform, which is a community information exchange. We work best through local partnerships with counties, tribal nations, hospitals, and other healthcare partners, housing providers, food vendors, and more. Oregon will provide health-related social needs benefits, including housing and nutrition services, for people who are going through life transitions. These health-related needs benefits will apply to people experiencing homelessness or at risk of homelessness, youth with special health care needs up to the age of 26, youth involved in the child welfare system, older adults who have both Medicare and Medicaid health insurance, adults and youth leaving correctional facilities and justice involvement, adults with serious and persistent mental illnesses who are leaving the Oregon State Hospital. At Obsidian Ridge Ranch in Harney County, peers work with individuals transitioning out of residential mental health treatment, helping them develop life and job skills for successful reintegration back into the community. Traditional health workers, including peer-delivered services in behavioral health, provide an essential touch point for people transitioning within the healthcare system and from systems such as child welfare, jails, prisons, and psychiatric facilities, including the Oregon State Hospital. Peer services are the glue that holds the continuum together for people experiencing challenges with system navigation or needing additional support. While CMS has not yet approved supporting peer services outside of a traditional treatment plan, we are encouraged by the emphasis and focus on peer services. The legislature has made historic investments in behavioral health during the 2021 and 2022 sessions. These investments total more than $800 million. Some of the investments are still in process. They'll bring new capacity in housing, residential services, crisis services, including the 988 crisis hotline and mobile crisis, respite and peer services, tribal-based behavioral health practices, and the implementation of behavioral health resource networks under Ballot Measure 110. House Bill 2949 from the 2021 legislative session established a loan repayment program for people in the behavioral health profession, with priority of offering the service to people of color, tribal members, LGBTQIA+ populations, veterans, people with disabilities, and people with limited English proficiency, adults in custody, and people living in rural communities. Both GOBI and EOCCO are in discussions about offering financial support, such as scholarships and loan repayment, for people in the behavioral health and health professions, or people seeking careers in these professions. Behavioral health rates in Medicaid are set to increase by an average of 30%. The fee-for-service Medicaid program has already posted a new rate schedule with increases. GOBI is proactively increasing contracted rates for providers who are reimbursed on a fee-for-service basis. Oregon CCOs will see capitation increases targeted to behavioral health beginning in January of 2023 through a directed payment option. Eastern Oregon University will implement 2 new graduate programs for people seeking advanced degrees in social work and clinical mental health counseling within the next year. I'd like to leave you with a set of recommendations to consider. First, invest in evidence-based clinical and community prevention, especially for children ages 0 to 5. These investments have the largest rate of return over the lifespan. There are a number of low-cost, effective, and proven interventions that are currently being implemented in Umatilla County. Bringing these programs to scale would help the community reap benefits in the long run. It is important to recognize that this work takes time. Results from effective prevention interventions and treatment do not fit neatly into annual or biennial budgets or political terms. Second, we need more affordable housing stock in this county and throughout Eastern Oregon. Consider investing in housing and related supports. If we were all to join forces with housing investments, we could make a collective impact in the availability of affordable housing in this region. Third, My behavioral health colleagues and I will be advocating for expansion of certified community behavioral health clinics, or CCBHCs, in Oregon in the 2023 legislative session. Certified community behavioral health clinics are a type of behavioral health home that provides a comprehensive collection of services that create access, stabilize people in crisis, and provide the needed treatment and recovery support services for those with the most serious and complex mental and substance use disorders. The federal demonstration RAP payment, similar to the payment model for federally qualified health centers, has allowed CCBHCs to finance the infrastructure needed to provide these comprehensive services for people with a variety of needs, regardless of their insurance coverage. An October 4th New York Times article titled "The Solution to America's Mental Health Crisis Already Exists" describes many of the positive features of CCBHCs. 3 CCBHCs exist in Eastern Oregon, one in Harney, Wallowa, and Grant counties. Community Counseling Solutions, the community mental health program serving this county, operates one of these clinics in Grant County. CCS is well positioned to demonstrate success with such a clinic here in Umatilla County. Fourth, I would also recommend that we continue building and strengthening relationships across the healthcare landscape that promote seamless transitions of care and better care coordination. Memorializing agreements that define roles and responsibilities is a best practice that I would highly recommend be used across the health and behavioral health care landscape. If you want to make a difference, but don't work in the behavioral health field, there are many things that you can do. You can volunteer, join a board, donate to a worthy organization, but first, consider waving at the person who is enthusiastically waving at you on the sidewalk. Say hello, be kind, let people know that you see them. Thank you so much for your time and for listening to my presentation today. Be well.
Thank you to all who are joining us from home. It is my privilege to represent our healthcare system and all of our Good Shepherd family, and to share about our progress and triumphs this past year. It is amazing what our healthcare system can accomplish in 1 year's time. The positive impacts we have made and the adversities we continue to overcome are a credit to our 750 employees who put our patients and each other first, always. It is a credit to our Board of Trustees, our leadership consisting of our executive team, department leaders, and clinic managers. It is also a credit to our physicians and clinicians, our volunteers, and our Good Shepherd Community Health Foundation. Together as one team, we are able to accomplish our mission to improve the health of their community. And that mission may seem so simple, but it is the driving force of our decisions and the work of our healthcare professionals that want to make a difference in the lives of rural Eastern Oregon. To fulfill our mission, we must listen to the voice of our patients. Patients' feedback give us opportunities to improve our processes and the patient experience at every turn. Our goal is to ensure our patients feel just a little bit better going out the door than when they came in. From March to May of this year, Good Shepherd received top rankings from our summary report scores of the Hospital Consumer Assessment of Healthcare Providers and Systems, also known as HCAHPS. Basically, I call this our patient satisfaction scores. But during these surveys, we asked our patients the important topics about how well nurses and doctors communicate, how responsive our staff are and to their needs, and the cleanliness and quietness of the hospital environment. During that 3-month span, Good Shepherd hit the 95th percentile in patient satisfaction for all reporting Oregon hospitals, and the 93rd percentile for all reporting hospitals in Oregon, Washington, and Idaho. Nationally, Good Shepherd reached the 89th percentile for patient satisfaction overall. We attribute these excellent patient satisfaction scores to our healthcare workers' focus on improvement projects and implementation of lean principles in their day-to-day work. It is clear to us that lean daily management is a vehicle for positive change and quality improvement in our journey to becoming the hospital choice for our patients and their families. This past year, our quality department partnered with other departments within Good Shepherd on our patient experience. Such projects included a pediatric mental health safe activities project, an emergency department patient recliner, toys for pediatric patients, a Commit to Sit project to implement stools for hospitals and patient rooms, and a new housekeeping hospitality cards in patient rooms as well. As part of our lean efforts, we organized 5 lean education sessions for our executive team and management to complete, 2 4-day value stream mapping workshops, and several other workshops for multiple departments. These efforts truly are an investment in our staff to provide them with the latest tools and education in healthcare. Our administration strives to take care of our employees so that they can take care of you. This past year, we implemented a resilience education and peer support program to help our staff meet the demands of the pandemic and support them with mental health guidance. Additionally, under the direction of our chaplain, Kirk Rule, we have created a soul care program that unites our local ministers and stakeholders in the patient care we provide at Good Shepherd. It is our belief that health care, well care, and soul care is total care. Our leadership has made it a priority to invest in employee education and support, and we partnered with community stakeholders to give you the best care possible. Part of delivering the best care possible is to recruit new doctors. We are pleased to welcome family nurse practitioner Kayla Sullivan to our urgent care last fall. We also welcomed another family nurse practitioner to our urgent care, Joanne Lewis, who has served as a nurse in our surgical services and emergency department for many years while completing her schooling to become a family nurse practitioner. Good Shepherd provides educational support to our employees that wish to advance their healthcare careers, as Joanne has demonstrated. It brings us great pride to be able to welcome our own to Good Shepherd's medical staff. As the community we serve grows, so must our facilities. Good Shepherd is expanding our footprint to better serve this great community. In June, we closed on the land purchased of the former Rogers Toyota of Hermiston property with plans to build a new state-of-the-art urgent care facility at the Highway 395 location. Our urgent care, currently located on Elm Street, will relocate to Highway 395 and provide one-stop care for our patients that need it. It will be a fully supported urgent care in the new location with diagnostic imaging and laboratory services right in the heart of Hermiston, offering more convenience, efficiency, and space to serve our patients as quickly as possible to get them back to their work and families. Additionally, we have made multiple campus-wide improvements this past year, including remodeling our critical care unit, operational updates to our emergency department, flooring and finishes upgrades, and finally, we laid out plans to move most of our outpatient clinics to our medical plaza. Each of these improvements to our infrastructure positively impacts our patients' experience. Good Shepherd has invested in the best technology available. This is no easy task, implementing the latest medical technology, which requires engagement and buy-in from the entire organization, from our board of trustees to our frontline staff. Medical technology is essential to prevent, diagnose, treat, and rehabilitate illnesses and diseases in the most safe and effective way. In the spring, we welcomed our new Da Vinci robot to our surgical services department. The Da Vinci robot allows our surgeons to perform complex surgeries with very few and very small incisions. Abdominal surgeries with the robot are typically less painful and more precise, resulting in shorter hospital stays and a faster return to life and work. Our new Canon Orion MRI system in our diagnostic imaging department provides the clearest, high-quality imaging available, and we are the only facility in our region that currently has this. Patients do not have to travel out of town to receive the best diagnostics available. We implemented a new hematology analyzer in our laboratory department, which is very new technology to assist emergency department providers with identifying patients suspected of sepsis to get antibiotics on board quicker. This has helped to decrease length of stay for our patients in the emergency department. Being the hospital of choice for our patients is more than quality care and the best technology available. It is also how we give back and support our community in other ways. The Good Shepherd Community Health Foundation continues to serve our community. The foundation dispersed $270,000 in grants and funds and awarded $92,000 in medical scholarships to 34 local students attending 21 various colleges and universities throughout the country. The 28th Annual Scramble for Scholarships Golf Tournament was held in June and was a great success with over 100 golfers participating. This event raised over $33,000 for medical scholarships to be given to local students. The Festival of Trees returned in December of 2021 and raised over $68,000, of which $34,000 was allocated to the Good Shepherd Community Health Foundation. A special thanks to the Foundation Board President Mike Henderson and Foundation Executive Director Liz Marvin. Good Shepherd has over 40 service lines to care for you. Today we are providing the most services we ever have, many of which patients are willing to travel from out of town to Good Shepherd. Here are some of the highlights to share with you. Good Shepherd Advanced Orthopedics provides joint replacements with the Mako robot, sports medicine, and podiatry. We are one of few facilities to have a foot and ankle specialist, Dr. Kyle Duncan, who is also a very skilled surgeon. Good Shepherd Cancer Center is a full-service oncology and hematology department operating under the direction of Dr. Stephen Iacoboni. Dr. Iacoboni is an experienced physician with a devoted following for his compassionate, world-class cancer care right here in Hermiston. You heard it earlier, Good Shepherd's general surgery team now offers robotic surgery in our state-of-the-art surgery suites. Good Shepherd Women's Center has a beautiful, comfortable facility to provide the full scope of women's services, and we are about to welcome our newest OBGYN, Dr. Alexis Tuck. Patients near and far utilize our cardio rehab center that offers a spacious rehab facility and a devoted care team. Good Shepherd provides our community with affordable diabetes education and consultation by covering 90% of the appointment costs for patients. We have grown our primary care services to meet the needs of Eastern Oregon to include 3 family medicine physicians, 4 family nurse practitioners, as well as 4 internal medicine physicians. Our Community Health and Outreach Department provided important health education classes and events to over 18,000 participants this past year. Our pharmacy team provides curbside pickup, as well as home deliveries by partnering with Good Shepherd's Caravan Transportation. Caravan performed over 1,400 medication deliveries and transported nearly 8,000 patients to and from their appointments. This year, we welcome back our 40 auxiliary volunteers, and our auxiliary recently awarded 4 medical scholarships totaling $8,000 to local students. And there's much more. We strive to increase access to care and services to meet the needs of our community. Which brings me to our last topic, the Community Health Needs Assessment. This assessment is an IRS requirement for which our hospital partnered with St. Anthony's Hospital to conduct a survey of Umatilla and Morrow counties to determine our population's health needs and areas of most concern. Out of that study, our Board of Trustees and leadership developed a community health improvement plan with 4 key priority areas that we attached goals and measures to. Those areas include mental health, obesity, nutrition, physical activity, women's, men's, and infant health, and finally behavioral health. These priority areas are tied to our organization's strategic plan. Please take a moment to review the Community Health Improvement Plan on our website, and we encourage you to reach out to us with any questions or suggestions you may have. Finally, in the throes of another uncertain year rocked by the pandemic, Good Shepherd continues to be financially stable. For every successful hospital, stability is attained and retained through investing and reinvesting in equipment, facilities, and its people. Other than the investments I have already mentioned, Good Shepherd invested over $440,000 in our employees by ensuring they did not lose money if they or their immediate family members became ill due to COVID. Additionally, our trustees awarded our employees several bonuses just to show their appreciation for their dedicated service to our community. And speaking of our community, Good Shepherd provided over $9 million for those that were in need and could not afford the cost of medical care. Additional financial information is available in our annual report, which can be reviewed on our website, gshealth.org. Annual reports will also be mailed out to communities within our service area later this month. In closing, I just want to say our commitment is to ensure that our patients and their families feel just a little bit better going out the door than when they came in. That is the Good Shepherd experience.
Thank you, Brian, for your presentation, and thank you, Karen, for your participation in our annual community meeting. Mental health is such an important topic, and we always appreciate the opportunity to learn more. I would also like to recognize and thank the rest of the Good Shepherd executive team, which includes Chief Operating Officer Jim Schlinker, Chief Financial Officer Jan Peter, Vice President of Good Shepherd Medical Group Troy Lagore, Vice President of Nursing Brian Patrick, and Vice President of Human Resources Janine Reddy. The annual report for the past fiscal year provides a detailed review, and it's available on our website at www.gshealth.org. It can also be accessed on our Facebook page. It's a great resource, and we appreciate the work of Caitlin Kozad, our Marketing and Communications Director, in making it available. That concludes this evening's program. Thank you again for joining us virtually for our annual community meeting. The interest, involvement, and participation of everyone in our service area is invaluable to us as we strive to provide you with the best health care we possibly can.